Well, thank you very much. It's a pleasure to be back at the Paul Torrens Forum to talk about healthcare. It's been one of my great honors to know Dr. Torrens over the years. There are many great colleagues here at UCLA, and Paul has certainly been one of my greatest colleagues over the years. So my job today is to quickly talk about the ACA, what's in store after the midterm elections. So first of all, I just want to remind everybody, the ACA is working. You may have heard contrary information. If you watch those ads, depending on who's promoting them, the ACA is the worst thing that's happened to the United States since you can fill in the blank. But the fact is that it's working. And when I say that it's not working perfectly. No, it's not. It is not a perfect piece of legislation. It's a compromise. It's an incremental step. But it's an incremental step that has produced enormous coverage gains in the United States. About 10.6 million people were enrolled in the exchanges earlier this year after the open enrollment season had closed. 87% with subsidies, 53% with cost-sharing reductions, despite the fact that the Trump administration is no longer paying those cost-sharing reductions. They're essentially being funded in a different mechanism, through a different mechanism now. There are more than 15 million people who are newly enrolled in the Medicaid program, almost 12 million through the expansion under the ACA, and then another almost 3.3 million who were previously eligible, who've come in through what's known as the welcome mat effect of being more encouraging for people to sign up for benefits for which they're eligible. So as a result, we have almost 22 million people who are newly insured relative to 2010 when the law was first enacted. It's the largest percentage point reduction in the number of uninsured in the United States, and the largest absolute number of increase since the enactment of the Medicare and the Medicaid programs in 1965. And just to illustrate what's happened over the last roughly 45 years in terms of uninsured rate in the United States, we've hovered for decades around 18% of the population. Almost 1 out of 5 Americans being without insurance. And look at what's happened since the Affordable Care Act. This is, we literally had fallen at a rate that we haven't seen since the enactment of Medicare and Medicaid. But I'd be remiss if I didn't point out what's happening at the tail end of this graph, which is that in 2017, that number is ticking up again. So the efforts to sabotage this law, short of completely repealing and replacing it, which I'll talk about the replacement in a minute, but the point is that the efforts to sabotage the law are having an effect and are reversing some of the significant gains that have taken place over the last few years. This is another way of illustrating the significant gains. This is my new favorite slide. This slide captures, if a picture is truly worth 1,000 words, this slide I could talk about for another 40 minutes because it captures a lot about the healthcare system in the United States. But what I want to emphasize is the dramatic decline since 2013 in the uninsured rate at every age category, every single age or year of age in the US population, with the possible exception of those 65 and older, because Medicare is so ubiquitous. Although, as you can see from the graph, we still have roughly 1 to 2% of seniors who are uninsured in this country. Getting to the midterm election, what is important to voters? So the latest Kaiser Family Foundation poll shows that, and not surprising, that healthcare is important to both Democrats and Republicans and independents as well. But the issues that are important with regard to healthcare do differ by political party. Democrats want to see increased access, they're concerned about healthcare costs, and they're concerned about improving the ACA. Independents are concerned about cost as well and increasing access, but they're opposed to the ACA and are more interested in repealing it. Republicans care about cost, but they also care about repealing the ACA. They want the current president to make good on his promise to get rid of this, what they consider to be a horrible law, because after all, it provides health insurance to millions of Americans. When we look at, and again, this is data from the Kaiser Family Foundation, what are voters in Florida, a key state that has not expanded its Medicaid program, what do voters care about in Florida? And what's interesting is protection for pre-existing condition. There truly is bipartisan support for this issue. The problem is that Republicans are lying to their constituents. They're saying that they're going to protect pre-existing conditions, and they're not. And I'm sorry, you can accuse me of being partisan, and you can say, Dr. Kominski, you're wrong, but I'm telling you, they're lies. They're lying, and if the base wants to believe the lies, that's fine. But there's nothing in the Republican proposals that are protecting people with pre-existing conditions, with the single exception that Republicans are saying, well, we'll guarantee that insurance companies have to offer you insurance. What they're not guaranteeing is community rating, which guarantees that you can afford the insurance when you have a pre-existing condition. What's likely to happen at the federal level? Look, there have been many elections in my lifetime, dating back to the early 1960s, that we could say were pivotal elections in American history. This is clearly one of them. This may be the most pivotal one in my lifetime. If the Democrats win the House, then I think the repeal and replace efforts are going to be indefinitely on hold. Republicans and the president are not going to have the votes to repeal the ACA. If they don't hold on to the House, and I'm assuming that the Senate is going to be Republican, if the Democrats do not take the House back, then we're going to see the ACA, I think, is going to be history. There will be a bill introduced early in January to repeal and replace, and it will pass. So I'll be here giving you a different talk, some sort of a post-mortem on what's going to happen when the law is actually repealed. And believe me, the replacement is not going to be a replacement. It's going to be something, but it's not going to be anything that's going to truly help people who've benefited. So I'm assuming that the Democrats are going to hold. I don't have time to go through, but here are the things that are currently underway. Even if the Democrats hold the House, there are a number of efforts to sabotage this law that are currently underway, including something that I just read about today that was announced last week that we can talk about more during Q&A. Finally, since my time is up, and I don't want to take time away from my colleagues, at the state level, regardless of what happens, there will be efforts to try and expand coverage and to hold our ground. Some of that was laid out in legislation that was passed last year, AB 1810, and we can, again, talk about this a little bit more in the Q&A, but at least I think California will continue to try and lead the resistance, even if the ACA is repealed, although if it's repealed, California is truly going to have an uphill battle holding on to the progress that we've made over the last 5 years. Thanks very much.